In the last 48 hours, I know that you have probably seen the numbers. 72% of the deaths in Chicago are African Americans, even though we only make up about 30% of the population. How is that and why is that?
It's really heartbreaking.
Very, very.
And that, we had talked, you had contacted me about this, we were catching up, and I think that was the same day that those stats came out.
Yes.
And you were like, oh, maybe interview's not your thing, but, I want you to think about it based on the discussion that we'd had. And, as a Black man and a doctor and a Chicagoan, it just like, I would not be a good steward to my own community if I didn't take the opportunity to try to educate people in this forum.
Why is it impacting us? Why are our numbers, why are we dying at a faster rate? In the beginning, everyone was saying Black people don't die from the coronavirus. And now we're seeing that, yes, we are dying and at higher rates. Why is that?
That was another misconception, but I do think it is multifactorial, and a lot of those things you hit on in asking the question. It's hard to undo, hundreds of years of healthcare disparities and inequality in quality of life, in life expectancy, maternal mortality, maternal morbidity. The Black population in America has a high degree of pre-existing conditions that increase your risk for having a bad outcome. I was literally reading that, cardiovascular disease, that's high blood pressure. I can tell you that I was on call last night. We worked for 24 hours. We intubated at least 6 patients between 7 p.m. and 7 a.m. And I want to tell you that 90% of those patients had some sort of cardiovascular disease.
Wow. 90%.
Some of them were under 60 years old. So cardiovascular disease is like the biggest risk factor. It's like 10%. Lung disease, asthma, COPD, being a smoker, almost 8%. It's like 7.8%. A little bit lower for diabetes, but it's also another high risk. It also increases all 3 of those problems increase your risk, for having a bad outcome if you contract COVID-19.
We're praying for you, as well as all of the other healthcare workers and those individuals who are on the front lines.